1 in 500 people in Maine are going to get exposed to Lyme disease. And when you're out walking around like this, there's some things that you want to think about. Actually, in the United States, in 2022, there were estimated to be about 460,000 cases of Lyme disease. That's a lot. And only about 65,000 of those were confirmed. That means 6 out of 7 people that have Lyme disease were never told they have Lyme disease. So we're going to do a talk today about ticks. We're going to do a tick talk. And we're going to do it here in the great state of Maine. My name is Dr. Zach Mazzoni. I work with the team at Something Better. And Something Better is a group of people who want to come together and help you to learn things that will make your life something better. From health, mentally, physically, and spiritually, we want you to experience complete healing. And unfortunately, there's some disease in our world that we're going to have to talk about and some things to help you prevent that disease. And if you're unfortunate to get exposed to Lyme disease or some of the other tick-borne illnesses, ways to get past that. So join us today as we talk about several things about ticks, about life, about nature, about God. We hope it's a blessing to you. Now, when we're talking about Lyme disease, what are we talking about? Well, we're talking about a disease that's actually a bacteria. It comes from the ticks. Now, it can come from other sources, but it comes primarily from ticks. What kind of ticks? The black-legged deer tick. And those come in different sizes and different times during the year. There's May when they start very small, and that's the larva. Then it goes double in size, and that goes into the nymph, about the size of a pencil lead. Hard to see, can get on your body anywhere. And then they go into adult male, about twice that size, and adult female, about 3 times the size of the nymph. But you're asking yourself, well, what is Lyme disease? Lyme disease is a bacteria. It's a bacteria that's transmitted by this tick. The tick bites you, and when it's done taking your blood to feed its babies, it gives you a bacteria in exchange. Not a very good deal. And that bacteria then can grow. That bacteria has a unique shape. It's a corkscrew shape, loves to dig into tissue. In fact, when it gets into your blood, it takes on average only about 11 minutes for that spirochete corkscrew to get through your blood vessels and into your tissue. This means if you have it on your body and it's in your blood, it's going to get throughout the entire body, and it's going to go to areas that are slow-growing tissue so they can feed on that slow-growing tissue. That's joints, which is where you're going to find Lyme disease all the time, commonly in the knee joint, usually just one, and then it may migrate to a shoulder, to a TMJ. It can go into the heart because that's slow-growing tissue. It can go into the brain, slow-growing tissue. This area you can see there's a little bit of taller grass in this area that we might have to come through, and we've done some prevention techniques today to decrease our risk from getting a tick on our body and getting bitten by a tick that might cause disease. Now, remember, the black-legged ticks are the ones we're after. Those are the deer ticks. Those are the ones that have Lyme and Bartonella and Babesia and Anaplasma and ehrlichiosis. These are the diseases that are common in our great state of Maine and also in the Northeast. And so those are the ones you want to watch out for. So what do we do for prevention? Well, before we started, we sprayed on cedar oil because that prevents ticks from wanting to get on. You can also drink things like cistus tea, which can prevent ticks from wanting to attach and actually bite. And you'll notice, I do have my long pants tucked in to my socks because I'm making a mechanical barrier. So when a tick might hitch a ride on me, it has to come up this way, and it has to come up light-colored pants that I can see a black-legged tick very easily. Now when it gets here, I've tucked my shirt in because it's going to be very hard for the tick to get inside and underneath, and it's going to continue to climb. It gives me a chance to look for where the tick might be, because at the end of this trail, I'm going to do a tick check with all my friends, and we're going to check each other, look in the hair, look around the neck. We're going to check each other as far as arms, under your armpits. Now for you, you also want to check private areas and every area around your body with your hands, and you just feel around for anything that's attached that's not coming off, and it may be very small. As you know, ticks can come in different sizes. So let's say at the end of this walk today, we find a tick on one of us. Well, what do? Well, the initial reaction is I want to crush it and I want to throw it away as far as I possibly can from me. And this is a time when you have to allow a sound mind to take over. you want to hold on to that tick because that tick may have disease and you may not know this, but you can test that tick. So what we have is we have some tape with us, or you can have small containers. Maybe it's a plastic water bottle that's disposable. Put it in the plastic water bottle. Hold on to that tick, and then you'll want to send it into some testing centers, and they can test the tick to see if the tick has disease. And if it does, now you know what you should be looking for disease for you if it was attached. Now remember, a tick can be attached for a shorter period of time. I've seen positive Lyme in 4 hours after attachment. I know that the standards say generally 24 hours, but there are unique situations where that may not be the case. If you have one engorged, you get it off. How? Carry a little instrument called a ticked off. It's a plastic scoop with a little V in it, and you basically just, here's the skin, here's the tick. You come in between the two, right on the jaws of the tick, and you scoop it up and hold it in that little plastic container. They're only about this big. They're not expensive. You can get them at pet stores. When you go hiking, take one with you. You can use it on your dogs. You can use it on other people. If you have tweezers, remember, don't grab the body. Grab the head because you want the whole tick to come off. And there's a weak point behind the head where maybe you just pull off the body. And if the tick stays engaged, that's an increased risk of infection, and you really haven't gotten off your body yet. So things to think about for prevention so you can enjoy transition areas and nature. I had a dog for many years, and I missed my dog. And my dog would run right next to me through this kind of brush. And it was wonderful. The only one concern is when we got back, we needed to check for ticks, because here in Maine and in the Northeast, and in most of America in some hot spots, you're gonna have issues with ticks. And ticks carry disease, and we don't want you to be overcome with that fear. We want you to learn about how to overcome your fear of ticks so you can enjoy this with your pets. So if you have a pet and they're coming through this, ticks will wait on blades of grass or on high ferns, right? They will attach to whatever animal comes by. And that's usually dogs, that can be squirrels, that can be cats if they're outside. That can be deer, which is the tick we're worried about today. The deer tick is the black-legged tick, and that's the one that carries disease. That's the one that carries Lyme disease, and anaplasma, and ehrlichiosis, and babesia, and Bartonella, and many other diseases. Now, there are other ticks out here. In fact, the majority of ticks you see around this area are going to be known as wood ticks or dog ticks. Those do carry some kind of minor diseases at points, but very rare. Like I said, when you're done with your animals and you're coming home, you got to check your dogs, your cats, you got to check other animals that you might have, but those are the common ones. And if they're outside animals, you want to think about, if I let them inside, I'm letting ticks inside my house. And if we choose to sleep with them, I'm letting ticks inside my bed. And this is often the case that I see. A lot of people don't realize where they came from. They woke up in the morning with ticks. Now, I've actually talked to several people that have said they're worried about even being around trees because they think the ticks are waiting for them and then they're going to leap off and jump on them. Ticks, I've never seen do that. Ticks generally will be lower in this grass area. Certainly, you want to think, could they crawl up a tree? But you'd have to brush by, and you'd have to allow the back of that leaf or blade of grass with the tick on it to brush against you and then to climb on you. This is usually where it happens, and I will tell you, 90% of the cases that I see, it's coming up from the ground or just around knee level and starting to climb up. Ticks are generally ground cover. I don't want you to be worried about going under any trees because trees are beautiful to be around. So Lyme disease is the one we hear about all the time, but remember, there are common other diseases called co-infections that are carried by ticks. Now, those co-infections can be Lyme disease, which is Borrelia bacteria. They can be Bartonella. It can be babesia, which is actually a red blood cell parasite. It can be anaplasma or ehrlichiosis, which attack different parts of white blood cells. But Lyme is our talk and our focus today. And Lyme disease is a spirochete-shaped bacteria that loves to burrow into tissues, and it's very, very advanced as far as its genome, and it can change its shape, and it can change a covering around it to be able to prevent the body from seeing it. And that's the problem, is you can have this for a long period of time, and it's called the great imitator. It used to be syphilis that was called the great imitator, and syphilis is a spirochete. So these two spirochetes, when they get into tissue, depending on where they get into that tissue, will be the symptoms. And you're thinking, well, what are the symptoms, Dr. Zach? What should I look for? Well, the primary two are always going to be significant fatigue, hard time getting through the day, can't get out of bed. And the second symptom, relapsing, remitting, intermittent fever that comes and goes. Generally not a fever in the morning, but you will generally have a fever towards the afternoon to the evening. It will be a lower fever, 101 to 102, and it will come and go. And it also can be on a cyclical basis. It can get worse every 4 weeks, has been reported in some people. In younger people, you'll see those two all the time. You can see a rash, right, called a bullseye rash or an erythema migrans. Now that is absent in at least 30% of the cases, and I've read up to sometimes 70%. If you have this bullseye rash, a widening rash that has red around the border and white in between and starts to grow, that should tell you you have Lyme disease. I can't think of another disease that does that specific rash, and you want to find someone, a doctor who's Lyme literate and can help you through those different treatments. Now, if you're in your 20s or 30s, some of the presenting symptoms are vertigo. You just can't seem to clear vertigo, or significant brain fog. Sometimes if you're older, we see this throughout the range, memory loss, inability to do normal tasks that you normally could do, but now you just seem slow in doing them. Joint pain in different joints, and it will move. Those are the things that you're going to see, and you can have heart issues, and you can have nerve issues in different parts of your body. Now, if you want to find out a more comprehensive list, you can get online and take a look at Dr. Horowitz, and he has a symptom tracker that's about 3 pages long that talks about the different systemic symptoms you'll see. That's something good for you to look at. And if you're high in that list, again, find somebody who's Lyme literate and can help you. Now, when you get into this, much as life, you're going to see different viewpoints. In our country, in our world, we shouldn't be afraid of different viewpoints. We want to have a sound mind. We want to hear people out. We want to pick the best of what's out there to come up with something better. And so what do we want to do? We listen to conventional, and we listen to the CDC and what they say. We take the best of that. And there's also going to be an alternative approach. And we want to take the best of that. And we want to ask the hard questions for both so that we're coming up with what is the best, truthful way to treat this. In my experience, that's by far the best treatment plan you can have. Now, many people will say, treat with antibiotics. The one that's most common is doxycycline. And that's the one that's recommended not just for Lyme, but actually for co-infections, except Babesia. You may be recommended by your doctor to take 2 days to 3 weeks of that antibiotic. The only problem is that antibiotic at that strength doesn't kill the bacteria, it prevents it from reproducing. And the life cycle of the bacteria is about 5 weeks. And so if I'm only stopping it from reproducing and making babies for 3 weeks, it's got 2 weeks afterwards to catch up. So you'll want to think about, if you have an antibiotic that can kill it, use it for a set period of time. But if you don't, like doxycycline, you may want to consider using it longer. Now, there's the alternative, or the integrative side. And those would be herbs, that would be lifestyle. And there's great data on that as well. In fact, Johns Hopkins University did a study in 2020 and 2021 where they showed several herbs actually had better ability to fight Lyme and Bartonella and some of the other diseases that are tick-borne than the antibiotics did. Namely, among those was Cryptolepis, Japanese knotweed, Chinese skullcap. Now, there were a few others, but for Lyme, those are the ones that I want you to at least explore. And again, find somebody who knows the dosing. I deal with a lot of people who think if a little's good, more's better. And they'll do way too much or not enough, way too long or not enough. Talk to somebody who's done this and has a good idea of how long you should be on these protocols, what you should take, and make sure you're coming up with a plan that makes sense and that somebody can say this works and why. Don't be afraid to talk to different people and explore what is truth on this. And we want to be able to help you do that. And so if there's questions, obviously reach out to us, nnec.org. Look up the Health Ministries team, and we'll be able to help you as well. and we'll have many videos on different topics because we want you to experience life to the full. Thanks for watching.